Signs Part 2, Signs 51 through 100. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. In this podcast, we're going to see examples of each of 50 imaging signs. We'll name the sign or descriptive term and name at least one disease in which the finding occurs. This is an interactive exercise, so make sure to pause your computer or MP3 player if you wish to take more time. Here's the first sign. What sign is depicted here? This is the juxtaphrenic peak sign, which is the tent-like projection of the medial portion of the hemidiaphragm seen with upper and sometimes middle lobe atelectasis. In this case, there's right upper lobe atelectasis. What sign is depicted here? This is the knuckle sign, which is a dilated pulmonary artery with abrupt tapering seen in occlusive disease like pulmonary embolism, shown here. What sign is shown here? This is a lead pipe colon, which is the rigid, ahaustral appearance of the colon classically seen with chronic ulcerative colitis. What sign is shown here? This is the trough sign, which is a linear fracture of the anterior and medial portion of the humeral head from a posterior shoulder dislocation. What sign is shown here? This is the Lufsichel sign, which is the sickle-shaped, overexpanded superior segment of the left lower lobe interposed between the aortic arch and the atelectatic left upper lobe to which the gray arrow is pointing. What sign is demonstrated here? This is the Mercedes-Benz sign, the triradiate appearance of air in a gallstone seen on CT and plain films. It's so called because of its resemblance to the car maker's logo. What sign is this? This is the misty mesentery sign, an infiltrative pattern in mesenteric fat seen with mesenteric paniculitis. What sign is demonstrated here? This is the molar tooth sign, which is the appearance of perivesicular fluid on CT in usually an extraperitoneal bladder rupture. What sign is demonstrated in this disease? This is the moulage sign, which is a dilated loop of small bowel with effaced folds resembling a tube into which wax has been poured. It's seen in sprue. What sign is this? This is the gloved finger sign, which is a finger-like projection from the hilum from bronchiomucoid impaction in allergic bronchopulmonary aspergillosis or in asthma. What sign is demonstrated here? This is the Napoleon hat sign, which is the inverted hat-like appearance of L5 on the frontal view in severe anterolisthesis. It resembles an upside-down Napoleon hat. What sign is demonstrated here? These are ribbon ribs, thinned ribs classically seen in neurofibromatosis, or regenerated ribs following rib resections. What finding is depicted here? This is laminated periosteal reaction, involving multiple layers of new bone formed in sequence around the cortex, producing an onion skin-like appearance, seen usually with sarcomas and in osteomyelitis. What sign is being pointed to here? This is a pad sign, which is an impression on a loop of bowel, usually by an extrinsic mass or organ. In this case, it was a diverticular abscess. What appearance is being shown here? This is a pancake kidney, which involves fusion of both the lower and upper poles of the kidneys. It's also known as a disc kidney. What sign is this? This is a pear-shaped bladder, which is the shape of the urinary bladder from extrinsic compression, from excess pelvic fat, as in this case, fluid, blood, urine, or adenopathy. What sign is being shown here? This is the pedicle sign, which is destruction of one of the two paired pedicles, usually seen with lytic but sometimes osteoblastic metastatic disease. The left pedicle is intact. The right pedicle is destroyed, in this case by lung cancer. What sign is depicted inside the red circles here? This is a pencil in cup deformity, psoriatic erosions in which the narrowed end of the metacarpal or phalanx inserts into the expanded end of the adjacent bone. What sign is shown here? This is pencil pointing, which is the tapered erosion of the distal clavicle, usually seen with rheumatoid arthritis. What sign is this? This is the polka dot sign, which are the thickened trabeculae seen on end on CT in vertebral body hemangiomas. What appearance is depicted here? This is popcorn calcification, flocculent amorphous calcification in solid masses, frequently indicating calcification of smooth muscle or cartilage, for example, in a hamartoma, as in this case. What sign is demonstrated here? These are scalloped vertebrae anteriorly. Think of pressure that can be produced by an aneurysm. Posteriorly, from spinal tumors, neurofibromatosis, or communicating hydrocephalus. This patient had neurofibromatosis. What sign is being demonstrated here? This is a pseudo-Wriggler sign. Multiple overlying loops of dilated gas-filled bowel create the impression of seeing both sides of the bowel wall. What sign is the red arrow pointing to? This is the puckered panniculus sign. The panniculus has a central indentation, almost always indicating previous abdominal surgery. What is this appearance called? This is a putty kidney, a calcified end-stage kidney resulting from autonephrectomy due to renal tuberculosis. What is this sign called? This is the 3 sign, which is a dilated proximal aorta, an indentation from a coarctation, and post-stenotic dilatation of the aorta, as seen in coarctation of the aorta. What appearance is depicted here? This is reverse pulmonary edema, in which there is peripheral airspace disease that spares the central portion of the lung, frequently seen with eosinophilic lung disease, as in this patient with Leffler syndrome. What sign is shown here? This is Wriggler sign, which is visualization of both sides of the bowel wall due to free intraperitoneal air, in this case from a ruptured duodenal ulcer. What sign is depicted inside the red circles? This is the rolled edge sign, which is the dense perimeter of a calcified pleural plaque when it is seen en face, usually secondary to asbestos exposure. What sign are the red arrows pointing to? This is tram tracking, which is the tube-like parallel lines representing thickened bronchial walls, usually seen with bronchiectasis. What is this appearance called? This is a rugger Jersey spine, in which there are sclerotic superior and inferior end plates of the vertebra from secondary hyperparathyroidism, usually seen in renal disease, and resembling the jersey worn in rugby. What is this appearance in the skull called? This is a salt and pepper skull from multiple small areas of resorption of the skull in hyperparathyroidism, which results in a mottled appearance resembling salt and pepper. What is this sign called? This is the thymic sail sign, which is the normal triangular appearance of the thymus gland caused in part by its interface with the minor fissure on the right side. What is this called? That's the famous Scotty dog, the appearance of the pedicle, transverse process, and facets on an oblique lumbar spine X-ray. What is this sign called? This is the shaggy esophagus, an irregularly ulcerated appearance of the lumen of the esophagus described with candidiasis. What is this sign called? This is the shepherd's crook deformity, a coxavera deformity with outward bowing of the proximal femur in fibrous dysplasia or osteogenesis imperfecta. What is the name of this appearance? This is the silver fork deformity, which is the descriptive appearance of the wrist with a dorsally angulated fracture of the distal radius, as in Colley's fractures. What sign is depicted here? This is the snowman sign, due to dilatation of the vertical vein and the superior vena cava, forming the head of the snowman in a type 1 supracardiac total anomalous pulmonary venous return. The right atrium composes a major portion of the body of the snowman. What appearance is depicted here? This is the snowstorm appearance of innumerable small pulmonary nodules frequently associated with metastatic disease from thyroid carcinoma. What is the name of this sign? This is the spine sign, which is the paradoxical increase in density that is seen over the lower thoracic spine on the lateral view, caused by something abnormal in the lung, such as pneumonia in this case. What is this sign called? This is the spinnaker sail sign, which is elevation of the lobes of the thymus by pneumomediastinum. The thymic sail sign is normal, and it's named after the spinnaker sail. What is this sign called? This is the steeple sign, which is seen in croup. It's the smoothly tapered air shadow seen at the level of the larynx on a frontal chest or neck radiograph because of subglottic swelling. What is the name of this sign? This is the soft tissue rim sign seen on CT. There is edema of the ureteral wall surrounding an impacted ureteral stone. It aids in the differential diagnosis from a phlebolith which does not have the soft tissue rim sign. What is this called? Thumbprinting, the indentation in a contrast or air-filled bowel lumen caused by submucosal infiltration, resembling a thumbprint, for example, in ischemic bowel. What is this arrangement called? This is the string of bead sign, multiple linearly arranged small pockets of air in an otherwise fluid-dilated small bowel loop seen in mechanical small bowel obstruction. What sign is depicted here? This is the string sign,